Since 1990, more than 500 patients have gone through various forms of operations to correct their heart ailments. That's all been made possible by a team of surgeons who make an annual trip here to provide life-saving surgeries. They are part of the Operation Open Heart team, whose trip has been organized by the Sydney Adventist Church.
Every year, these group of volunteers from Australia and New Zealand visit the country for a period of 2 weeks. Their goal, to provide specific forms of surgeries that would otherwise be financially out of reach for many of the patients. Patients from all 3 divisions are screened before a final list is chosen.
I think they screened 114 children and at least 100 adults, and they came together and discussed the patients who would be suitable to be done here. And with that time frame, the resources and everything that we bring with us, also financial considerations, we'll have about 60 slots for patients to be done during the 2 weeks.
And it seems one form of heart ailment was quite common amongst patients.
The patients that we mainly operate on have what's called a hole in the heart. So they're born with a connection between the 2 pumping chambers of the heart, and so their heart has to work very hard when they're born, and that means that they're often quite sick and they get lots of chest infections. And they have quite a hard time putting on weight as a baby and that sort of thing.
This time around, the youngest patient so far is an 18-month-old baby, but the team have operated on younger patients in the past.
About 1 in 100 children broadly across the world have a congenital heart problem that needs surgery. So it's fairly common, and it is very important in terms of the child's health. It does really affect them, and will shorten their lives considerably if it's not fixed.
The team have visited 11 countries, including Fiji, to perform the same service.
This is actually the 100th trip that a healthcare outreach program has done. We do 3 different strains of outreach, which is cardiac, also reconstructive surgery, and we're also doing hand surgery, cleft lip and palate surgery, and burn scar contracture surgery. So we have been to 11 different countries.
For 4-year-old Kinisimera Nuravi, the surgery she underwent yesterday has given her a new lease of life. Diagnosed when she was 2 years old, some of the difficulties she used to endure were shortness of breath and loss of appetite. Today, her mother was over the moon.
Ni rawa me ratara itu o irango mai na kila baka daka itu beira na nora bengarabi mera solira tu mai mera mengarabi kina berna ngone baka toki lubengo o maruta ka uba beni na tana kalu na buku ni nora na solia tiku beira na baka rauni alo mera kawa itu mai ni tu eso era ngandre pasar tu nga mera mbau buke.
With still a week to go for this team, one thing's for sure. They will definitely leave the country with a lot more healthy citizens. Amelia Vinilamba, One National News.